All right, welcome everyone to the June Veterans Briefing. We'll get started in just a few minutes, but if we would encourage you to share some information about yourselves in the chat, specifically your name. If you are joining from a veterans service organization, if you could share the name of your organization. And then finally, if you're a military veteran, if you could share your branch and area of service, we would appreciate that. Again, we'll get started in just a few minutes. Welcome everyone to the June Veterans Briefing. Again, we'll just get started in a couple of minutes. If you are just joining us, if you could share your name. If you're joining from a veterans service organization, if you could share the name of your organization. And then finally, if you're a military veteran, if you could share your branch and area of service, we would very much appreciate that. And again, we'll get started in just a few minutes.
If anyone's looking for volunteer opportunities, our Veteran Serving Veterans program is an amazing way for veterans to give back to the community. Atul is one of our program coordinators for volunteer opportunities, and we do community pinnings, and these are some of the photos that you're seeing as we're waiting for people to join the call today. But if you know of anyone or yourself are interested in volunteering opportunities, whether that is as a veteran or a civilian partner, please feel free to reach out to us.
I'll jump in and share a little bit actually about the program that I am the program coordinator for. It's an AmeriCorps National Service Program. If you're not aware of AmeriCorps, similar to the Peace Corps, but essentially the service is done here in the US. You see the slide right now, which talks a little bit about the AmeriCorps program. It's called Legacy Corps for Veterans and Military Families, and it's a respite care program. We provide non-medical training to people who are part of the program, and then they go to patient homes and allow the caregiver to get a couple of hours off each week to run errands or to just kind of relax. So if anyone is interested in that, the new service year is starting September 1st. So if you or anyone you know is interested, for essentially a higher level of commitment, you sign up for a year, and some of the benefits of that include a very modest monthly living allowance, which covers gas expenses and things like that. And then you also have an opportunity to earn an educational award at the end of your service.
Thanks, Atul. Empath Health hosts a variety of coffee groups around the community for veterans, including a virtual option, which is a fantastic networking opportunity. That's the flyer that was just on the screen. Our longest running coffee groups are at the Sunshine Center and the Gulfport Senior Center. We have a lot of veterans attending those each month. It's just a social opportunity for vets to come together, connect with each other, and community resources. We've launched 2 women veterans coffees as well as an LGBTQ veterans coffee group as well. So they're a fun opportunity, very social, very interactive, if they so choose. But we'd love to see you attend one of those if you're looking for a way to connect with others in the community. Tammy's going to be our presenter today. We're going to hold all questions till the end of the presentation. So if you do have a question during the course of her presentation, do feel free to put that into the Q&A, and we'll answer that at the end of the slide presentation. So without further ado, while Atul is queuing the slide deck, it's my honor and privilege to welcome Tammy Martin with Wounded Veterans Relief Fund to the webinar today. Tammy and I cross paths a lot out in the community in our outreach to the veterans and veteran service organizations. She has been in the dental industry for a great amount of time and is a subject matter expert, and her and I are both passionate about education and connecting veterans to resources. So I said, I need a speaker for June, and she said, I'm on it. So Tammy, thank you for fitting us in this week. I know you have a busy week with the conference. Thrilled to have you here to educate our attendees. It is being recorded for those who cannot join us today. So I'm excited to hear about oral health and how that impacts our overall health, and some of the resources that your organization has and others in the community. So welcome.
Thank you so much for having me, Trudy. It's a pleasure. Thank you. So my name is Tammy Martin, and I am with an organization called Wounded Veterans Relief Fund, and I'm actually the outreach dental coordinator for the program. We are a nonprofit where we help veterans that are at least 30% disabled up to 90% that are not able to get their dental care done through the VA. As we know, a veteran has to be 100% disabled in order to qualify to get dental benefits through the VA. So I go out in the community, I have the whole state, so we partner with dentists, and then we have a suggested fee schedule. So we actually pay the dentist to see the veteran. Some of them actually say, just send me a couple a month. Don't worry about sending us any money. We'll be happy to do this. And then we have others that will split the fee in half. So right now we have 70 dental partners throughout the state. And after this presentation, I'm actually heading to the Florida Dental Convention, where I hopefully can come back with 70 more dental partners. So we're looking forward to that connection. We are funded through grants, sponsorships, gracious donors, and anybody that obviously just wants to go online, and even if it's $5 a month, some people do $5 a month for the whole year. It helps a veteran in some point of their treatment. So we're very gracious for that. Okay. Okay, so today's presentation is about how oral health and dental health kind of like come together and meet. We really need to educate the community more that a lot of systemic issues going on with a veteran could be stemming from actually their oral health. What we've seen since we've been doing the dentistry in 2 years is that most of these veterans have severe periodontal disease. A lot of their teeth are missing. So I just, when I met Trudy and I was like, when she asked me to do something and present, I'm all about the oral health and the whole body and how it's linked. So I think it's important that we teach everybody and give them some basic knowledge without going into a lot of scientific, and just let them know that the bacteria in our mouth can cause a lot of systemic issues. So here on the first slide, periodontitis is an inflammation disorder of the supporting tissue of the teeth. So in other words, what happens is when you have periodontal disease, I don't know, when you go to the dentist, sometimes you can feel where they're probing all around in your mouth and they're calling numbers out. That's showing how deep the pocket is. So when you have periodontal disease, the pockets are very deep. Well, that means too that it's getting into the bone. So what we want to try to do on the other side is definitely diagnose, is it periodontal disease? And obviously that's what holds the teeth in place, right? So if it starts eating away at the bone, The tooth will then become loose, and then you're going to lose the tooth. Either it's going to fall out or you have to have it removed. Next slide. Okay, so I like to look at it like your mouth is the gateway to your body. To understand how the mouth can affect the body, it helps to understand what can go wrong in the first place. So bacteria that builds up on the teeth make gums prone to infection. The immune system moves into attack, and the infection and the gums become inflamed. The inflammation continues unless infection is brought under control. Over time, the inflammation and the chemicals it releases eats away at the gums and bone structure that hold the teeth in place. The result is severe gum disease, known as periodontitis. Inflammation can also cause problems with the rest of the body. So if you look at the picture here and the big red circle where the bacteria, that is actually bacteria going through the bloodstream in different parts of the body. Good examples are Alzheimer's now and dementia are being linked to periodontal disease, strokes, cancers, heart disease, respiratory disease, osteoporosis, diabetes, obesity, and sexual reproductive. I'm going to touch on the osteoporosis for a moment. We just finished a veterans treatment here in Pinellas County. She had been going to her doctor for osteoporosis treatment. Nothing was working. They couldn't figure it out. They were like dumbfounded. Finally, one of the doctors on her team asked her how her overall dental health was. And she kind of showed them. She opened her mouth and she did have an upper denture, but on the lower, she had a few teeth left and she was filled with periodontal disease. So we sent her to one of our local dentists here. They worked on her, did periodontal therapy. They extracted a few teeth. She was able to save a few teeth and we put her in a partial. She went and had her lab work done 3 weeks after. And guess what? She was successful to get her treatments. So it's very important that we really educate medical doctors and dentists to keep looking and digging. So that's a great success story for her, and she's doing very well. Next slide. Your mouth is connected to the rest of your body. What happens in your mouth affects the entire body. And again, I'm going to keep going through and repeating this because each slide, as we see, it's going to touch a different part of our body, actually. So bacteria and their byproducts enter the blood, lungs, stomach, and have a profound impact on the entire system. The bacteria in the mouth enters the bloodstream and affects other parts of your body. Specific bacteria in the mouth is linked to serious health issues, including Alzheimer's, dementia, strokes, heart disease, diabetes, rheumatoid arthritis, pregnancy and related complications. I used to work for another organization that we served veterans for dental, and I can't tell you how many times I would look at their overall health history and how many open heart surgeries they've had, but nobody ever looked in their mouth because they weren't eligible for dental. And we're going to get into one of the slides here in a minute on endocarditis, and it was specifically linked from the bacteria in their mouth is why they were having to have these heart procedures. I've also seen veterans that have had toes cut off, fingers cut off because of diabetes being so out of control, but the infection is coming from their mouth. Next slide. Bacteria from the mouth can actually kill you. When gums bleed, the bacteria can enter the bloodstream and can infect other parts of the body. In the case of endocarditis, this affects the inner lining of the heart and surfaces of its valves. The bacteria sticks to those surfaces and creates growths and pockets of bacteria. And you can actually see on the screen there how they actually connect over by the mitral mitral valve and the aortic valve. Next slide. I like to say, in balance lies the power. The oral microbeam is meant to be in balance, and the imbalance in dentistry is referred to as oral diabasis. Oral health is not achievable without good bacteria. Kind of sounds kind of backwards almost, right? But we still want the good bacteria in our mouth. Killing the bacteria does much more harm than good. We must recognize that not all bacteria are our adversities. Bad bacteria, although potentially is harmful, are a nature part of our environment. Instead of attempting to eradicate them completely, let's strive to ensure that they're kept in check by a thriving community of beneficial bacteria. And you can kind of see around the tooth here how it's held into the gums. And then over here on the left side of your screen, you'll see the homeostatic immunity, the systematic of the health, and how it's all, and then your diet. And then over on the right side, you can follow it around and see how it's all kind of like, here's one here, the one that amazes me is the oral cancer in cells. And we're going to jump into that in a bit too, how they're now diagnosing and seeing cancer related to gum disease. Next slide. Oral bacteria and poor oral health increases the risk for tumors and metastatic cancers. I honestly never knew this until I started really researching more. And again, it's the bacteria in our mouth. Increasingly considered to interact with and promote the number of inflammatory diseases, including cancer. In the case of oral squamous and carcinomas, the local inflammatory response associated with periodontal disease is capable of triggering and altered cellular events that promote cancer cell invasion. That is just amazing to me. Next slide. Okay, bacteria of the oral cavity play an important role in the development of oral, colorectal, and pancreatic cancer. The most well confirmed is the cardiogenetic, which is having the potential to cause cancer effect. Bacteria causing development of a tumor affect on human cells in 3 ways, leading to chronic inflammation, acting as cell death, and producing cardiogenic substances. Gum disease can be linked to rheumatoid arthritis. A recent study was found that individuals with rheumatoid arthritis had gum disease and overall bacteria in their bloodstream, which triggered the activation of cells associated with joint pain. The study highlights the importance of good oral health and hygiene for overall well-being. I'm just going to touch base on that one slide. Do you know how sometimes it's like that impending doom, like if you're having a heart attack, it's like, oh, I'm not having a heart attack. Sometimes, somebody will say, you'll hear, especially an older person, they might have a really deep joint pain, or maybe their arm is just something just doesn't feel right, but they go for test after test after test. And again, they come up with nothing. Who's checking their oral health? So if you ever hear of anybody with just these crazy aches and pains, don't overlook it. Ask them, how's your oral health? And have them get checked, because it could be stemming from periodontal disease. So gum disease can increase the chances of experiencing a stroke, and patients who have suffered a stroke can also face worsening of oral health. In a stroke, blood flow to the brain is interrupted, causing cell death and impairing essential functions. This physical trauma often leads to difficulties in maintaining proper oral hygiene routines. Brushing, flossing, rinsing may become challenging tasks, and some stroke survivors may require assistance. Moreover, stroke recovery patients are more susceptible to dental problems. Facial paralysis can allow food particles to become trapped between their teeth, leading to plaque buildup. Weakness of the facial muscles can also result in ill-fitting dentures, irritating the gums. This is always very worrisome for me for patients in nursing facilities, right? We all want to make sure that their oral hygiene is being checked and their dentures are fitting properly. Additionally, certain medications prescribed for stroke prevention can reduce saliva production, impacting the mouth's ability to rinse and clean itself. Pregnancy outcomes. Women who have periodontal disease 6 times the odds of giving birth to a premature baby. And that's compared to women who have no periodontal disease. Preventative solutions, including the use of periodontitis screening tools for nurses and midwives during prenatal care. Consultations are highly recommended. This one here always amazes me too, is the kidney. For individuals with kidney disease, it's important to understand the potential impact that periodontal disease can have on overall health. Researchers have shown a link between periodontal disease and chronic kidney disease. As patients with chronic kidney disease have an increased risk of an infection due to a compromised immune system, this can lead to chronic inflammation that can potentially exacerbate kidney disease. Patients with end-stage renal disease and periodontal disease have a strong association with cardio mortality. Periodontal disease and pathogenic bacteria were associated with 5-fold increased risks of cardiovascular disease related death in a retrospective study of that's fine. Okay, understanding the connection between mental health and dental health. Suffering from bad dental health can play a role in deteriorating mental health illness. This, to me, with our veterans that have mental illness, our organization, when we give them a smile back, we're not just giving them a smile back, right? We're getting them healthy. But the biggest thing that we're seeing is that a lot of these with PTSD kind of go into hibernation. They don't feel that they can go out and smile in public. They're embarrassed about how their teeth look, and it can trigger a full scale of anxiety, can cause to refrain socially, can affect low self-esteem. It decreases personal relationships with them, their job. They want to become isolated. We had one young girl, she was very educated veteran. She fell off her bicycle and broke her front teeth off, and she couldn't afford to get the teeth fixed. So she found our organization, but in the meantime, she was actually very educated and was very outgoing and wanted to be out in the public with her degree, which she wanted to work with. But she found herself working in a cubicle wearing a mask. So she was very isolated with a job opportunity. Recovering addicts, dental pain with years into sobriety, but still carry battle scars of past addictive lifestyles, can trigger use for opiates and alcohol. So I'd like to see us get more into the mental health facilities where they're staying at before they enter, and let's get them checked for oral hygiene before they get into a program, right? Maybe they do have some infections going on. Maybe they've had a tooth that's just been very sensitive for a while, But how can they focus and concentrate on their treatment if they have this pain and discomfort in their mouth? So then they go through all these weeks or months of treatment for PTSD or mental health illness. Then they get out, but they still have this problem in their mouth. Are they apt to go back to opiates and alcohol? Probably. So I would love to see, before they enter these treatment centers, that they all get checked for an oral hygiene to see if there's any issues going on. Next. And this just shows you how everything just comes full circle. The mental health problems, right? Eating disorders, damage to the teeth, tooth decay, bad breath. So it just it just keeps going around and around and around. And then the mind starts swirling, right? The mind just keeps going around and around. So you have a veteran that's having some issues, but you have them circulating through this little circle here. We want to be able to help them before it gets to that. Next slide. So there's an organization called American Institute of Dental Public Health, and they're located in Texas. They're an amazing organization. They do a lot of studies. They break it down even by states for veterans. And they kind of partnered up with Senator Sanders. And this information here I took out of their bill, that they're trying to get a study done for veterans. It's going to be a pilot program, and show the government and the VAs how much money they would actually save if they would just open dental up for all veterans. Because you have all these veterans with medical issues, and the money that they're spending on these medical issues, when it could all be preventative. So out of 9.2 million veterans enrolled in the VA healthcare, only 1.4 million are eligible for comprehensive dental. In 2020, VA Dental Services provided care for more than 460,000 eligible veterans, and only 80,000 additional veterans purchased dental insurance. In 2020, 2,993,000 veterans enrolled in the VA were diagnosed with diabetes, while only 433,000 were eligible for dental care through the VA. Likewise, 639,000 for dental care, were diagnosed with ischemic heart disease, while only 161,000 were eligible for dental care. This left just over 3 million veterans with diabetes and heart disease without access to affordable comprehensive dental care to treat and prevent periodontal disease, increasing their exposure to the fatal risks associated with these conditions. In 2020, the VA spent an average of $86,000 per veteran on healthcare with heart disease, while it spent an average of $11,000 on veterans with diabetes. Compare that with the $1,132,000 costs the VA annually to provide veterans with comprehensive dental care. It's estimated that 50% of veterans are treated for gum disease. Over $6 billion could and would be saved annually in heart disease and diabetes treatment. And that is data from the American Institute of Dental Professional Health. That study blows my mind. Next.
So let's jump in there, Tammy, before we jump into these additional resources. At this point, I do want to open it up for Q&A based on the slides that you've shared before we go into the community resources. So Atul, do you mind going back to that last slide? I think I agree. Some staggering statistics and numbers there, right? if we could get more preventative processes in place for more veterans. And this is across the board for civilians and veterans, right? I mean,
Yes.
this is periodontal disease isn't exclusive to veterans, but for the sake of our
Correct.
presentation, we're focusing on vets. So, you know, if we can invest in preventative services, the savings in the long run are significant. So I do at this point want to open it up to any Q&A. I don't see any Q&A in the chat. Jim has raised his hand. Let me see. Bear with us, Jim. I'm going to see if we can unmute you. All right, go ahead and see if you want to unmute Jim and go ahead and ask your question.
Hi, can you hear me? Hello?
Yes, we can hear you.
Okay. I just wanted to say, it is so important what you're saying. I was, when I was active duty military, I was the dental liaison for our squadron, and all of the active duty military personnel have to go have dental exams, and that's part of the readiness of our squadron. And they'd fight me like tooth and nails. They hated me because, you know, I was Mr. Dental Hygiene and I had to, you know, get them in here to do that. Now I work with people who have had substance abuse problems, and many of them have horrible looking teeth. And it is so hard for them to go to an interview and get a job because they look so bad, and that I have seen so much difference in their recovery rate in when they have been able to go and have corrective measures done to their teeth, and it's like a miracle shot. I mean, you know, you can just see, and they get these jobs, and now they have self-confidence. Before, they wouldn't smile, they would put their hands in front of their faces, and, you know, all these different kinds of things. Yes, it's just, that's all my comment. Thanks.
Thanks so much for sharing, Jim. Jim's one of our amazing veterans serving veterans volunteers, and I thank you for reiterating what Tammy's presentation showed today, and from a frontline perspective out there, keeping the troops in check. And yeah, any thoughts, Tammy, on Jim's comments?
Again, I get to do that every day, James. I get to put that smile back on their face. Oh, it's even I get emotional because I'm listening to James talk. I was even starting to get emotional because we get to see that. We don't just get to change their smile, but it gets them back to feeling good about themselves, relationships, going out to eat. They're not in pain, or they're not afraid because they don't have, some of them don't even have teeth, right? So once you get them even dentures, you can't stop them from smiling. And I'm a firm believer that, especially the ones that have had addictions, we of course like to know that they have gone through treatment, because we want to stand behind them, we want to support them, we want to make sure that they're healthy, and it changes their life, as James knows. It just blows my mind. I get to put my head on my pillow every night and just thank God for what we're able to help the veterans with. Thank you, James.
So we have another hand raised. Michelle, I'm going to unmute you, or I'm allowing you to talk there, so you just probably have to unmute on your end, but go ahead with your question.
Can you hear me?
Yes, ma'am.
Hey, Tammy, Michelle with the VA.
Hi, Michelle.
I've already connected with Tammy, and I met her at the women's event at Empath Health. So, you know, I think it would be an awesome thing to have the VA. I think you and I, Tammy, talked a little bit about it, doing even some type of, on a scale, you know, an income scale level, to have their teeth done, because I work with a lot of veterans that have addictions, or they're in recovery now, and they do want to find a job, but because of their poor mouth health, don't feel confident enough to do that. So it's very discouraging to them, you know, because they do want to find a job, but you also have to be presentable, you know, in those things. And I agree with everything that's been said. And hopefully in the future that the VA will look at all this and attempt to do some type of quality control, something like that, call it. Sure, but because there aren't a lot of places out there that will help veterans that don't have a lot of income, you know, because a lot of the veterans I serve are on HUD-VASH, you know, they have vouchers or they're Section 8 or, you know, they're on a limited income, but you know, we all know that when you have mental health, working does help that. You know, feeling good about yourself does help that. So it's trying to, you know, how many birds can we kill with one stone? So I appreciate everything that you do, you know, for your community. It's a pleasure talking with you and getting some information about that.
Thank you, Michelle, for your comments and for supporting us with our recent Women Veterans Resource Fair here at Empath House. We had an impactful day in our communities, so thank you for attending. And you raised some really great points. And that's something I want to talk about, Tammy, is for a veteran to be referred to your program, that referral has to come from a VA social worker. Is that correct?
That is correct. And we've also recently are letting the VSOs refer,
Okay.
as long as they can provide the information that is needed. So, and again, that disability rating is 30% up to the 90. Long as they, you know, are not able to get dental through the VA, obviously. And then once we receive their referral, our program manager will then receive it, okay it, and then she sends the application from our program to the veteran. They have 7 days to complete, and then their link will expire. So we encourage them, because we are working in the whole state of Florida. So we're getting, you know, social workers are sending us from all over the place. So we've been handling 24 to 28 referrals a month. So it's very important. If they don't fill it out in that appropriate amount of time, they're going to the bottom of a stack, unfortunately, and they're going to lose their place. So as more referrals come in, it's going to just jump right in front of those. We can't hold it. So we encourage them to get on there, do it immediately. I just had a veteran the other day that literally did it in 20 minutes after he received the link and shot it back. And he was like, am I in? And I'm like, yeah, you made it in. So, you know, we encourage the social workers to please let them know when they get that link, definitely get on there and fill it out. So yes, thank you.
Perfect. Thank you for clarifying that. So let's jump to the next slide and let's dig into this a little. So for a lot of us out in the community working with veterans, we know that they may or may not have applied for healthcare through the VA healthcare system. For those not so familiar, when you think of the VA, there's 3 separate entities. One is the healthcare system, one is the VBA or the Benefits Administration, and then you have the cemetery. So if you're working with a veteran, or and we always encourage asking the better question, did you serve in the military versus are you a veteran? Reason being, and we actually heard this from Vanessa Thomas with FDVA on at our women's event, a lot of veterans don't self-identify because they may have served in peacetime, or they maybe didn't deploy to a combat zone. Perhaps their MOS doesn't resonate in their mind that they're a veteran. So by community partners, community health care providers asking the question, did you serve in the military? It opens a more robust dialogue than, are you a veteran? So let's tackle the first component of this. We need to encourage these veterans to explore eligibility with the VA healthcare system closest to them. So here at Bay Pines, I do have the main hospital number and the extension. So for any veteran that does not currently receive health care from the VA, they can explore eligibility criteria. And once they're in that healthcare system, as Tammy mentioned, that social worker referral can come through to Wounded Veterans Relief Fund, and the dental team can start looking at eligibility criteria for that veteran. So as Tammy's mentioned a couple of times, unless a veteran is 100% service connected, they won't receive their dental care from the VA. So then we're looking to these outside entities, and we have several listed that we're going to go through today. The second component of eligibility stems into the benefits sector. So working with VSOs, like Tammy said, they're now taking referrals from a VSO, or a veteran service organization. So that's any entity like FDVA, Pinellas County Veteran Services, DAV. The VFWs oftentimes have a veteran service officer, and that is the person that's navigating the benefit system to see if the veteran has a service-connected disability that may entitle them to disability or certain pensions. So that's another aspect to encourage former service members to explore, is the benefits piece. I want to talk really briefly about a program that we have at Empath Health. It's our Suncoast PACE program. So this is for seniors 55 plus. It is a federally funded program through Medicare and Medicaid. So it's typically working with folks who are lower income, and they're needing support to stay healthy and independent in their home. So if you know of a veteran or a civilian that meets that criteria of living in Pinellas, 55 plus, and just really starting to be on that cusp of losing their independence to stay safely at home, and maybe edging towards the assisted living setting, it's worth a call to the PACE team to see if that person may qualify for the PACE program, at which time, if they do, the PACE program takes over the management of their health care. So that becomes an all-inclusive medical model where our physicians, our therapists, we maintain their health care. We send in home health aides to the home to assist as needed. We have the adult day program, and they're also working with specialists, cardiac physicians, endocrinologists, dentists in this light of dental hygiene, making sure that the participant in the PACE program has that all-inclusive whole health aspect to their medical care. Empath Health also obviously has our palliative care and our Suncoast Hospice, Tidewell Hospice, and Suncoast Hospice of Hillsborough programs. So Tammy has mentioned a lot of chronic and advanced illnesses through the course of the slides today: Alzheimer's disease, cancers, rheumatoid arthritis. When you're working with folks in your setting that are experiencing chronic and advanced illness and they're needing extra support, please do refer them to us for an informational visit. We can send out liaisons to work with that individual and the family to ensure that they understand what resources are available to them through those programs, and we're happy to do that. So we promised dental resources, and we've listed a few here today. So Tammy, I know that you're familiar with most of these, so let's just kind of work through the list.
Okay.
This was one I pulled from NSU. I believe that's NSU stands for Nova
Southern University.
Okay.
And
So they
actually
yeah, so
Yep.
I found that they have a $10 dental screening, and I've put the phone number and the web address there if anyone's wanting that $10 dental screening. But do you have any insight to them?
Yes, I've actually toured their facility, and it is just amazing. This facility here actually is for dentists. It's an international. So they've already have their dental degree from their country, but then this facility at Nova, they do 3 years, and then they can go apply for their licensing here in the States. I've been out there, I've talked to their professors, their deans. I've talked to some of the deans from Nova Southeast, from down south of us, have come up, had roundtables with them. toured their facility. It is top notch. Their equipment is top notch. Their students are top notch. I would trust any member of my family to go out there and have any of these dental students work on me. Absolutely. I'm just totally impressed. But yeah, you can call out there. The last I checked, they were like 2 weeks out making appointments. They just started seeing patients actually in May. So they're ready to go. They're, like you said, the $10 to get them out there for their first exam and to see what's needed. And they do have a fee schedule, and their fee schedule is very, very nice. I'm going to say a crown is like $500 out there. So yeah, it's very nice.
Good. So let's be clear to make a distinction. So we've got VA healthcare system when a veteran is 100%. When we have a veteran who is using VA healthcare, that's between 30 and 80% and has a critical dental need. That's where Tammy's Wounded Veterans Relief Fund and their dental program can come into play. So some of these resources we're going to be sharing and working through right now is really for our preventative and our if Tammy's team can't take care of them under their process. These are a lot of sliding scales, lower income resources, uninsured or underinsured resources. So oftentimes what I like to do when I'm on a presentation is I grab my camera, my phone, and I take a picture of the screen. So these are going to be good resources if you're working with veterans in the community and they're just trying to look for that stopgap of a dental professional to help them with cleanings, screenings, x-rays, and things like that. So NSU per Tammy is somewhere where she would send family, and I think that's a great testimony, and that you've been in the facility is great.
Yes.
SPC Dental Clinics, so St. Pete College also has students training. So I verified today their cleaning and x-rays start at $45. Any familiarity with them, Tammy?
Yes, actually, I've been helping a couple of their hygiene students get patients. So yes, I would not have a problem, honestly, of sending anybody down there. Only thing I like to tell people is their appointment is going to be about 3 hours. So be prepared. That initial visit will be 3 hours. And if you need a second appointment, it could be 2 to 3 hours. But definitely great facility. Been there, toured that as well. Very clean. Their instructors and deans are amazing. So great opportunity in the community for somebody that needs a cleaning and x-rays.
And is that the wait time that's 3 hours or the actual procedure because it's student-based?
Student-based, actually, you're 3 hours sitting in that dental hygienist chair with an instructor coming over or a dean coming over. It's very lengthy.
Okay. But affordable. So there's
Yes.
some trade-offs there, and
Yes.
you're assisting in a student honing their skills to go out for the good of the community. So
Correct.
excellent. Let's jump to the next slide, Atul, and see what other resources we have. So Ivara Health, they used to be community health centers of Pinellas. Their whole healthcare program is targeting underserved, low income, uninsured, and underinsured communities. They have locations throughout Pinellas County, and they do have a dental component. So the contact number for them is listed on the screen. Any comments on Ivara Health, Tammy?
I'm honestly not familiar with them.
Okay.
But yeah, thank you.
Mm-hmm. Tampa Bay Dental Solutions, I also recently spoke with them. They are located in Newport Richey. This is a private practice that offers a sliding scale for uninsured veterans and various specials. Currently, they have a new patient appointment, complete exam, see the dentist, and get x-rays for $45. And starting on August 23rd, they are also incorporating free cleanings into that special for veterans. So starting August 23, a veteran would be able to get a free cleaning the complete exam, see the dentist, and a set of x-rays for $45. So again, another community option, that sliding scale for uninsured veterans, just trying to meet that need of preventive maintenance, and the need of a veteran needing service. St. Pete Free Clinic, SPFC, also has a dental program. That is the direct extension there. 319 takes you into the dental program. Their services are intended for those who lack access to medical care due to lack of insurance, must be 18 plus, must be uninsured, or must meet the low income status. Any comments on either of those folks, Tammy?
Not familiar with that one.
Okay. Community Dental Clinic in Clearwater. Tammy and I were talking about this provider just before the start of the call, so you're very familiar and complimentary of this team. What are your insights to this resource?
Yes, I love them actually. I've been there. Obviously, I've toured it. I've know a couple patients that have actually gone there. Wonderful treatment. 200% below poverty level. However, they are trying. And you don't have to prove anything. Like they're going to ask you over the phone and hope everybody's on the honesty program, right? Like, do you fit the criteria? Yes. But they are trying to push it up to the 300% because of obviously the way the economy has been the last few years. So they're trying their hardest. And I believe they're going to try to do it on a case-by-case basis. So even at that 200% poverty level, don't let it discourage you. Just call them and let them know what your situation is. And I really believe that they'd be happy to work it out.
Perfect. Thank you.
You're welcome.
Yeah, and I think that's a good point. Oftentimes just leading with, I'm a veteran. Do you offer any sliding scale for a veteran? Do you offer any specials for veterans that may be a good nugget to share with a practice if you're reaching out for establishing as the new patient or cleanings or screenings. Let's go to the next slide. All right. So this is Walmart's dipping their toe in healthcare, for those of you who don't know. And they have created a brand spanking new health clinic at the Pinellas Park Super Walmart location on US 19. So as you come into the Walmart location, it's to the right over where the garden center is. And it's a whole separate clinic, separate entrance. So you can go buy your loaf of bread and your gallon of milk and then pop over to the health center for your dental visit. But they also do x-rays, primary care, as well as mental health. So Walmart truly is becoming a one-stop shop. And Tammy had shared this resource with me several weeks back. You've toured, you had very complimentary things to say. So if you, as the dental expert for the group, would like to share your takeaway from the Walmart Health Center, and then we can kind of go through some of these prices, as opposed, for me, I've never had to do extractions or crowns, so I don't know what these numbers look like relative to other providers. So let's kind of dig into this a little.
Okay. So I actually went to the one on US 19 in Park. And you've heard of the secret shopper? I was the secret shopper. If I'm going to be referring people to places, I want to sit in the chair and I want to see what happens. So I did. I went in from the time how I was greeted, 10-star. Taken back to my chair, 10-star. The doctor, 10-star. The hygienist, 10-star. I've been in dentistry for over 30 years. It is the most the professionalism in there was amazing. And because in my mind, I'm thinking right next door is the produce, right? Like to me on the other side of the wall. And I'm thinking, and I just couldn't get my head wrapped around that I'm literally sitting in a dental chair in Walmart. And I'm having an implant done, not there because they don't do implants, but I had a tooth. So it was a great experience. And that's why I went there. I needed to have an old root canal tooth extracted that has a crown on it. And it's been there since 1983. And going back to the whole oral health thing, Trudy, I don't know if you remember, but I was really sick for like over a month with just congestion and I couldn't get rid of it. Well, guess what it was linked to? My root canal. It was an old root canal tooth. So, made the appointment, went in there. And if you see on the extractions, Trudy, where's it, non-surgical and surgical?
Simple extraction 135.
Simple, yep. So the difference between those two extractions, number one, if it's simple as if the dentist does not have to take a burr to the tooth to cut it, okay? A complex extraction, if they put the burr to the tooth to slice it so they can take it out easier. Well, I'm thinking old root canal tooth, crown on it. I was prepared. And she's a tiny little dentist, probably weighs 80 pounds. And I'm thinking, this tooth is probably going to come out in about 10 pieces. She's going to have to dig for it. I am not kidding you. She never popped the crown off it. She got it out with one. She didn't have to put a burr to it. And two, she did every single thing that a dentist should do to be able to work that tooth to get it out. And it ended up being a simple extraction. I was like, I thought the crown would come off. I thought the tooth would need to be sectioned, all this stuff. No. And I'm being honest. I never had any discomfort. I healed perfectly. And I would give this location a 10+ star all the way around. It just amazes me. And as far as fees go, usually in a dental office, a simple extraction could be over $275. A complex extraction could be $300 to $400. So it's a huge savings.
Yeah, and
Their
we have
crowns are $750.
Yeah, if you want to flip a tool to the next slide, we have some continuing prices. And so let's kind of look at those in comparison to, and I think, to be good advocates today, when we're referring these veterans to some of these resources, have them ask the questions, do their homework, and kind of shop around for the best price or service or fit. But yeah, you talked about, root canals. What would that run in a typical office?
Root canal, especially if you went to a specialist and not just a general dentist that does them, you're looking at like $1,800 for root canal.
So significant savings there.
Yes.
Yeah. And so they have all the different preventative and diagnostics. Do we have another slide there at all? Okay, so that's it. So yeah, some well-rounded. If we could actually go ahead and put Tammy's first slide back up so that everyone has Tammy's contact information, I think that's important for the group to have. We've got a couple of minutes to the top of the hour. I want to be respectful of everybody's time. Let's open it back up for Q&A. If you do have a question or comment, feel free to raise your hands and we'll give you access to unmute. I'm not seeing anything there. Any final comments or thoughts, Tammy, as to what we've presented on, or a success story, or here we go, we've got James. So think about that as a final thought, Tammy. But let's open up for James again.
I'm sorry, real quick.
Yeah.
I've moved up. I'm in Pasco, so I'm working in Pasco in Hernando County now. And I wondered if you could give me any resources up here.
Tammy, do you?
I can definitely look some up for you. Absolutely. I can send out, Trudy, if it's from the ADA, and you can zero it in for Florida, and they have it's a booklet that you can just download, and it will show you all the places through all the counties in the state for dental.
Okay.
For low-cost dental.
Perfect. And I can email that out to you, Jim. All right. Any other success stories, Tammy? I know that you talked about the female veteran and that the positive impact that Wounded Veterans Relief Fund and your dental program had for her. Any others? Without,
They're
I can't
all
give
pretty-
you a virtual Kleenex, but
Yeah,
is there a
I
story?
know. They really all are, Trudy. I'll give you an example. I have a Vietnam veteran out of Hillsborough. Where's the tissues? Really just so he's at 80%, been trying to get to the 100% for over a year and a half. So Agent Orange, he's had all kinds of cancers. He's had gastro problems. He's had a feeding tube for over a year. And just struggling because all the acid reflux, right, from his gastro has literally rotted his teeth. It just ripped the enamel off it. So his teeth are very sensitive. He's getting infections. He ran into somebody from the DAV in Hillsborough, and the man had my card from the DAV, and he goes, call her. And so he called, never thinking that I would, number one, he said, answer the phone. Number two, when I asked him about his social worker, if he could get the referral, he didn't even know he had a social worker. How do I find out who that is? And this was on a Friday at like late morning. And I said, well, see if you can call out there and find out. Well, he called me back. He was just very, you could tell he'd probably been on the phone for a couple hours, just getting transferred. And he says, but I just can't believe it. I found you and you just keep answering your phone. I have hope on this.
Mhm.
So finally, I thought, I'm going to reach out to my program manager, because he did find out what her name was. The first name, that's all he had was her first name. I reached out to my program manager, Jade, and she's going through her list of contacts, and she said, I bet this is her. I have her email. She goes, can you give me the last four of his social real quick? And I'm like, absolutely. I got that. Jade emailed that social worker. That social worker responded within 30 minutes, sent Jade every single piece of information she needed, and said, I can't believe this because I'm leaving. Today's my last day for a week. I'm going on vacation. We had it done in one day where he could actually get his referral. And actually, he's scheduled for the second week of July locally to start treatment.
Excellent.
But he was at his end wits. He was
Mhm.
like, there's no way that it's going to become possible. But honestly, Trudy, all the veterans that we complete, some of them haven't had teeth, some of them are edentulous. It just brings their life back. The girl that was, in a cubicle, that just blows my mind, right? Very educated, but wore the mask, sat in a cubicle, couldn't let anybody see her smile. All of our veterans are just flying high. Just they all have their life back, truly.
Yeah.
We're
Well,
fortunate.
Well, thank you so much for what you do, Tammy, and to the Wounded Veterans Relief Fund and this initiative. If you could please do me a great favor and put your phone number into the chat for everybody
Yes.
to grab. If you do have any one-to-one questions or additional resources, I think you've heard how passionate Tammy is about this sector of healthcare that, from the sounds of it, is really overlooked into the whole scheme of whole health. So do feel free to reach out directly to Tammy. The recording, I apologize for last month. I did not hit record. So we did record this month's session, and that will be on the briefing page for you to refer back to, or refer other colleagues, veterans, associates to watch for themselves. And I do want to let you know that July's briefing, we will not be holding. I'm going to be in Nashville for a VA community meeting. So I will be out of town. So we will not have a meeting in July. However, we'll be back in August. So we will keep you posted as to what that topic will be about. I hope that you found today useful. And do please feel free to reach out to those resources and Tammy directly if you have any additional needs. But to all of our veterans and former military service members, current military service members, thank you for your service. And to our community partners, thank you for what you do to support our veterans. And I hope everybody has a great rest of the day.
Thank you so much.
Thank
Bye.
you. Bye.